Diabetic neuropathy, types, symptoms, causes, and therapies. Diabetic neuropathy is a complication of diabetes that results in damage to the nervous system. Neuropathy happens when high levels of sugar in the blood damage the nerves in the body. It can affect virtually any nerve in the body, with a wide range of symptoms. Some involve the peripheral nerves, while others damage the nerves that supply the internal organs, such as the heart, the bladder, and the gut. Between 1/3 and a half of people with diabetes have neuropathy, according to the National Institute of Diabetes and Digestive and Kidney Diseases, NID. Four main types of neuropathy can impact on the nervous system, including peripheral symmetric neuropathy. This affects the feet and hands. Autonomic neuropathy, this occurs in the nerves that control involuntary functions of the body, such as digestion, urination, or heart rate. Thoracic and lumbar root, or proximal, neuropathy, this damages nerves along with a specific distribution in the body, such as the chest wall or legs. Signs and symptoms will depend on which type of neuropathy and nerves it affects. Charcot's joint, in which a joint breaks down because of nerve issues, often in the feet. Peripheral neuropathy that affects the feet can make it difficult for a person to stand and walk. When a person cannot feel heat, cold or injury, this can lead to new problems. Muscle contractions and weakness. Proximal neuropathy can lead to pain in the lower body, often on one side, and weakness in the legs. Symptoms of focal neuropathy can vary widely, depending on the nerve affected. People with diabetic neuropathy often do not realize they have it until the symptoms are more advanced. Not all of the symptoms of peripheral neuropathy are visible, but people should be aware of any wounds on their feet. A physician will carry out a foot exam and may check blood pressure, and changes in skin color. The first step for people with any type of diabetes is to bring blood sugars within a target range, around 80 to 120, or agreed upon range with a doctor, and manage high blood pressure and cholesterol levels. Managing glucose levels will minimize the risk of diabetic neuropathy. A key part of treatment focuses on reducing pain and managing some of the symptoms. Certain medications and types of physical therapy can help to control the pain of diabetic neuropathy, alongside other treatments. Physical therapy, used in combination with other methods, might help relieve pain and reduce the symptoms. Electrical nerve stimulation is a painless type of physical therapy that might help to reduce feelings of stiffness and enhance the healing of foot ulcers. It helps to prevent and stabilize foot complications, such as ulcers and injury. A good physical therapist will ensure that exercises for people with diabetic neuropathy do not hurt the feet, which can be sensitive. Other therapies include devices that stimulate circulation, which can be used at home. Therapeutic ultrasound is another type of physical therapy that uses very high-frequency sound waves to stimulate the tissue beneath the skin. This can help some people to regain sensitivity in their feet.